The idea behind transculturalizing endocrine white papers and endocrine ideas and activities and care models is to optimize endocrine care for a broad array of endocrine diseases. We're really at the initial stages of education and working with local thought leaders in their effort to adapt ACE algorithms and guidelines so that they can be applied locally and then optimize care of the local population. Well, imagine if you would, domestically, if you were a doctor in Washington, D.C., and you had somebody who worked at an embassy and one of their relatives got sick. And whether the relative lived in the U.S. or if the relative was visiting from abroad, but from a different culture, let's just say they're Asian Indian, and they come in to see you, are you really equipped to be able to help that person, even though the problem's within your subspecialty? So for instance, if the patient had diabetes, how are you going to discuss nutrition with somebody who is Jain? There's somebody who's accustomed to the foods in India, accustomed to a lifestyle and a culture that's Asian Indian. And obviously the same could be applied to the Latino population or the Southeast Asian population. So I think the question is that doctors are busy, and now we're talking about introducing something that is potentially adds a level of complication to the practice of medicine. Well, the answer is that's the world we live in. So it really is a wash, because on a week-by-week, month-by-month basis, we're asked to practice under new regulatory constraints. Clearly, there's more knowledge. We would hope, as organizers of our ACE annual meeting, that every endocrinologist leaves here not just with affirmation of knowledge, but with new knowledge. And does that new knowledge always complicate their practice? No. It improves their practice, it improves their results and their outcomes. And it would be within that framework that I would answer the question that approaching patients with a transculturalized context would actually make it easier. They would have better results, and the patient would derive better care. Well, I think we start off small. We start off just by highlighting the low-hanging fruit, the more obvious, the easy aspects of what different cultures have. So, for instance, the glutinous rice consumption in Southeast Asia or in India, or in the Middle East, the lack of a lot of physical activity, religious issues in the Islamic faith with wearing a lot of clothing, not being exposed to sunlight even though you have a hot climate. In certain Latino cultures, the type of foods that are consumed, and the social practices and the way in which foods are consumed at mealtime. What we're hoping is that we'll have interest, that we'll have different organizations approach us, perhaps wanting to collaborate, that we'll have access to other guidelines from other countries, perhaps to review and consider whether we want to endorse them or not, or help out with the transculturalization process. Our goal is not to write guidelines, competing guidelines for other regions, but rather to assist in another region transculturalizing those guidelines or algorithms to produce various educational activities, but also, and here's a very important point, to apply these practices, to apply this knowledge domestically as well, so that practicing physicians in different regions of the U.S. exposed to patients from different socioeconomic strata, different cultures, ethnicities, will be equipped to optimize their ability to deliver care. I'm not so aware of it being done in as structured a manner. I think that everybody's aware that there's a need, and I think there are many people who do it because they're well versed in it and they're able to do it. But I don't think that there's been a concerted and structured effort to do this and to improve and develop an expertise in it. As to why it's important for endocrinology, To me, that's somewhat obvious when you look at the prevalence rates of obesity and diabetes squarely falling within the responsibility of the clinical endocrinologist.